Congenital heart diseases are heart defects that are present at birth. It happens when the heart or the blood vessels don't develop normally, and about 1% of live births have this defect, which makes it the most frequent defect. Survival has greatly improved since the past 60 years or so, and now 90% of children with congenital heart diseases can reach childhood. There isn't not much known causes for these heart defects, but some factors that could affect is viral infections during pregnancy. So, for example, rubella, like this child here, or some genetic syndromes like Down syndrome are associated with higher risk of congenital heart diseases, and also alcohol or drug abuse during pregnancy. Some general symptoms of a heart defect are heart murmurs. So when your heart makes sounds that are not normal, a bluish tint to the skin seen in this baby because of deoxygenated blood flowing to your body instead of oxygenated blood, rapid breathing, poor feeding, poor weight gain, fatigue during exercises for older children, and also lung infections. There are many ways to diagnose a congenital heart disease. It can be discovered during pregnancy, after birth, or even during adulthood. So one method is cardiac catheterization, which measures the pressure inside of the heart and blood vessels and shows images of the chambers and the great vessels. So how it works is a thin flexible tube called a catheter is passed through an artery or a vein at the top of the leg or groin, so here, or sometimes in the arm, and then it sends X-rays to see blood vessels in the heart and can determine if the blood is mixing between the two sides. Another method is coronary angiography, which inserts a dye through the catheter so you can see the heart and the arteries better. Another way to diagnose it is using a chest X-ray. It shows the size and the shape of the heart and lungs, and it also shows bone conditions. You can check your heart for unusual shape or if it's larger than normal. You can also see valve disorders, and you can see cardiomyopathy, which is enlargement of the heart, or heart failure. So you can see the heart is this part here. A third way to diagnose congenital heart diseases is using the echocardiogram. It uses sound waves like ultrasounds to create a picture of the heart. It shows the shape, texture, and movement of the valves and the size of chambers and their condition. You can detect heart murmurs and damage to muscles, like in a heart attack, or infections to the heart. You can also detect abnormal heart sounds, shortness of breath, palpitations, angina, or history of stroke, and it's very useful for valve problems. A fourth way to diagnose congenital heart disease is using an electrocardiogram, or ECG. It checks the heart and function by measuring electrical activity of the heart. Each heartbeat is an electrical impulse, so when the wave travels through the heart. This causes the muscles to squeeze and pump blood from the heart. It's recommended if your child or yourself is experiencing arrhythmia, which is abnormal heartbeats, chest pain, or palpitations. It's used to detect abnormal heart rhythms and or detect heart problems like a recent or ongoing heart attack, or abnormal heart rhythms. You can also detect coronary artery blockage and areas of damaged heart muscle, like after a heart attack. You can see the enlargement of the heart if it's there, or the inflammation of the pericardium, which is the sac surrounding the heart. You can also detect non-heart conditions like electrolyte imbalances or lung disease, and it monitors recovery from heart attacks. You can monitor the progression of your heart disease or the effectiveness of certain heart medications or a pacemaker. It's often used to rule out hidden heart disease in patients before they go for a surgery. Another way to diagnose heart disease is using an MRI, or a magnetic resonance imaging machine. It uses harmless magnetic fields and radio waves to get a clear, sharp picture of the inside of your brain or your heart. It's usually used to detect bleeding in the brain and tumors or signs of stroke, but it can also be used to scan your heart, and is more detailed than a CT scan because it can be viewed in 3D. The last diagnostic piece of equipment is the MRA, which is the magnetic resonance angiography, or the MR. It's a newer imaging technique and is used to detect the blocking or narrowing of arteries in the neck and the brain. It uses strong magnetic fields and radio waves to take pictures of blood vessels. And this one also creates 3D images of specific veins and arteries, like in this picture here. It's clear to see. You can see which ones are blocked. So, moving on to treatments of congenital heart diseases. One treatment is the ACE inhibitors. They're called angiotensin converting enzymes inhibitors, and they're usually given to people who have high blood pressure, heart failure, or coronary artery disease, and often after a heart attack to prevent complications as well. What it does is it helps control blood pressure, makes it easier to pump blood, it makes you feel less tired and short of breath, and it reduces the risk of heart attack, stroke, and death in people with coronary artery disease. It works by reducing the activity of an enzyme, these angiotensin converting enzymes. These enzymes help to create a protein called angiotensin 2, which raises blood pressure by causing the vessels to narrow. So when you take this, you lower the blood pressure by lowering angiotensin 2, and it creates a better blood flow, and your heart doesn't have to work as hard, so it puts less strain on your child's heart, especially with defect. There are many types, including benazepril, like in this picture. But our name is Lotensin. There's a whole bunch, but I'm not going to read them all out. So another type of medication are beta blockers. These are called beta adrenergic blocking drugs, and they're given to people with high blood pressure, heart failure, abnormal heart rhythms, chest pain, and is used to prevent heart attacks, reduce anxiety and migraines, and reduce tremors caused by an overactive thyroid. It does this by blocking responses from beta nerve receptors. This slows the heart rate and lowers the blood pressure. So again, it makes it's easier on the heart. It doesn't have to work as hard. Another medication is the diuretics. These are water pills, and they're usually given to people with high blood pressure or heart failure. What it does is that it makes the kidneys produce more urine and remove excess salt and water from the body. Different types are spironolactone or zeroxyline, Lasix. There's a whole bunch. Another type of medication is digoxin. It's given to people with heart rhythm disorders, heart failure, or weakened heart muscle, and it improves the pumping action of the heart and slows it down, so it makes you less tired and short of breath. One note is that you need to avoid black